Great, thank you, and welcome to our briefing for August 6, 2020. Apologize for starting a little bit late. We actually have a little bit of a technical difficulty. If the sound seems a little bit off, we had an issue with the microphone, so hopefully that's been resolved. And we'll go ahead and begin with our COVID briefings that, of course, we do every single Monday and Thursdays at 3 p.m. I'm going to, of course, give a briefing. Our director of the health department, Kelly Colopy, will also be following me. And of course, we're going to have our Spanish translation after questions. And of course, we always have our ASL translation as well. This week, earlier on Monday, we released our 2021 budget recommendations and budget for the city of Long Beach. And we talked about that at our last press conference we had just on Monday. Our city budget is $2.6 billion. Of course, it includes our seaport, our water department, all the infrastructure, public safety, health, all of which makes our amazing city. We have 500,000 people, and it's a significant budget that we adopt. The budget that we have presented is balanced, like all 6 budgets that we've presented since I've been mayor. But this year is also different. And unlike other budget years, we have a COVID-19 crisis that is greatly impacting the city. In fact, the COVID-19 crisis has put our deficit at $30 million as we enter this next fiscal year. Now, we know that the economic impact of this pandemic, which is the largest public health and economic crisis in our lifetime, has meant severely reduced revenue. We're talking about loss in tax revenue, hotel and tourism revenue, unemployment is going up. And so normally the city would have so many more revenue sources, but of course COVID-19 is affecting us here locally and everywhere pretty dramatically. This crisis is unprecedented, and there is just no way to avoid significant cuts. And certainly I've already heard from some, and I understand, that they don't want to see certain cuts, certain types of services that we have. In fact, every department in the city is receiving cuts with the exception of the health department. And I understand that, but the truth is that we have to make significant cuts because COVID-19 has dramatically affected our budget, and it is a once-in-a-generation type of pandemic and emergency. And just to give you some perspective, the city of Long Beach has already spent over $100 million on this pandemic. We provided almost 125,000 free COVID-19 tests, 125,000 free COVID-19 tests. We put together a field hospital. We've passed out free PPE to small businesses, to nursing homes, to clinics. We have a contact tracing team in place, and of course expanded our services around homelessness. Now, much of this that we have spent will be reimbursed to us, hopefully by FEMA and the federal government. But a lot of it won't, and that impacts our budget. So we have to do everything that we can to really honor the work we have to do and work with our state and federal partners. Now, I led a coalition of mayors earlier this year to secure almost $41 million from the state and the federal government through the CARES Act. We also partnered with LA County to receive almost $14 million to partner on testing. But that work isn't done. I'm working every single day to ensure that we bring in more funding from both the Congress and the state to ensure that we can balance our budget and provide the services that you all need as it relates to COVID. I also want to note that it's important that we scale up our health department. In this time of budget cuts, we must not cut public health. Our access to public health, being able to take care of those that are not insured, and ensuring that everyone is safe and stable, because we know that will allow us as a city to move on and rebuild our economy quickly. The smart choices we make today are going to ensure this crisis ends faster and that we can take care of every single member of this community. I now want to move on and share some of our COVID-19 data. So as of today, we had over 8,700 residents who've tested positive for COVID, but also about 7,300 that have recovered. We have lost 180 lives in Long Beach. 124 of those, of course, were long-term care facility related. We've been talking about that a lot at these updates, but that's 180 families and 180 lives. And as someone that is obviously has lost a member of their family, their mother, to COVID, I know that those 180 folks are not just statistics, they're real people. I want to go over today some of our health data. And before I do so, you're going to hear from our Department Director for Health. There has been some issues at the state level around laboratory reporting, and so they are updating that information. And so we have some information, but the first data point, which we're going to show you on this graph, is really about cases by episode. On this data point, which we really rely on the state for information, we could see some changes when the state updates their reporting. During our last data presentation 2 weeks ago, our case count was about 7,200. Our case count today, of course, has increased. Is about 8,700. And we need to make some, careful when we make conclusions about this chart. Now, one could look that maybe things are improving by just looking at the chart, but please know that there's always a lag in cases and that there is a concern about the state's reporting that we need to really think about. And so we're not exactly sure where the cases by episode data are. We are likely not seeing a huge spike, which we can probably interpret from the data, and hopefully things have leveled off. And we will know once we get the data complete from the state whether we actually are making some sort of improvements. But there are some improvements in some other areas, which we'll go over here in a minute. I do want to again note that we are doing significant testing and continue to do so. This second graph, of which the numbers we have here locally, and we're not required to get information from the state, of course, is deaths per 100,000. These deaths, as we all know, while we're above the state, we still are below the LA County rate in our reporting. And so we are, of course, losing approximately 1 to 3 people on average on any given day. And our hearts go out to all those families. But those are our deaths per 100,000, and we've seen that graph before. I now want to turn to hospitalizations over time. Our hospitalizations, of course, are reported daily, but over time the numbers change as we gather more accurate information. As you can see, the number of people hospitalized has decreased slightly over the last couple of weeks, which is good news. But again, this is information that can be fluid. We currently have 92 residents that are currently in our local hospitals. If we remember not that long ago, just certainly last week, we were averaging over 100 that were hospitalized. And so that number is decreased just a little bit, and we're hopeful that it stays that way and continues to decrease. I want to now turn to this next graph, which is about our hospital data. As you can see, our hospital capacity continues to remain stable. We're at about 57%. And we have been anywhere between 55 and 60% over the last few months. That is a good sign that we still have capacity and an ability to surge if we have an emergency in our city. But it also is reflective of the hospitals and the way that they are managing other types of emergencies or surgeries within their hospital. They're really trying to clear their hospitals. Of course, we still have an additional 325 surge beds available if we need to put those in place at the hospitals, and the 100 beds at the convention center are still there in case of an emergency. You can see, of course, that our ventilator use is at 41%. That number has increased slightly, but we still have ventilators available if need be for any member of our community. I also want to just note that we have put out over we have stored over 1.5 million units of PPE that's in our inventory. We put out, of course, an immense amount of PPE. And so I want to thank all of our partners who've been great partners, including the state, to ensure that we have enough of this protective material for our local nurses, hospitals, clinics, and community organizations. I now want to also just mention one of the things that people have been talking a lot about and asking about is how we can support our businesses safely. I had proposed an Open Streets initiative just a few weeks ago, and now, of course, we have a full Open Streets program that the council has been incredibly supportive of. We have over 100 temporary parklets all across the city. You see them on 2nd Street and downtown, in central Long Beach and Bixby Knolls, all across the city. We have an additional 15 that are being permitted and that are in the progress to be approved. These outdoor parklets, of course, are safe. They allow businesses to expand, to provide meals. I've even seen some parklets where folks are giving haircuts, where folks are actually doing manicures, which are allowed under the state now, and so these continue to expand, and we'll continue to support them. We're also seeing the closure of certain temporary streets at the residential level, and that will continue. We'll have more closures in the future. And if you are a business who wants to create a parklet or go into your parking lot and open up your restaurant, please contact the city. We have the 570 4biz line, which is a great way of getting information, and we encourage folks to reach out. Before I close and turn this over to our health director, I also just wanted to make sure that all small businesses are aware of this, this update. I promise to our business community, as did our entire city team, that any business that was vandalized or looted that night of May 31st, that we would come in and provide assistance. We promised that we would support any business that needed help, and that's exactly what we've been doing. Supporting these businesses remains a top priority of the city. So I asked, and the City Council agreed to establish a Rebuild Long Beach Relief Fund, and this is a fund that helps businesses that were looted or vandalized. We currently have $1.25 million available for grants. And so if you were a business that was affected and want access to one of these Restart grant programs, please reach out to us. You can, of course, call 570-4BIZ, or you can even come to City Hall. We have an outdoor plaza information table, and we can help you apply just right there on the spot. There's no appointment is even necessary. Or email us, if you'd like, at the number 4, which is 4BIZ, at LongBeach.gov. We want every business to get assistance, and that's been our commitment, and it'll continue to be that way. I want to turn this over now to Kelly Colopy, our Director of the Health Department, and her team have been doing an excellent job of managing this health crisis. Kelly.
Thank you, Mayor. Good afternoon, everybody. Happy Thursday. So as the mayor mentioned, the state of California has discovered an underreporting of COVID-19 cases due to technology issues with their electronic laboratory reporting system, which reports into the state's disease registry system. This is called CalReady. So CalReady is the system where communicable diseases are reported. So it's not just COVID, it's also issues around things like sexually transmitted diseases, vector-borne diseases, and others. So not only is it crippling our ability to have the most updated COVID data, it's also impacting our ability to respond to other disease outbreaks that we're paying attention to. We know that the patient care and test results are not being affected or delayed by this at this time. It is a reporting space, and our local labs are continuing to report test results. So if you visit your healthcare provider or you visit a hospital, those data are being reported directly to the hospitals, and they have that information. In addition, our hospitalization and death information is not being impacted as they're reported through different systems. So those data, as the mayor mentioned, continue to remain up to date. Locally, our team is working to manually enter the lab results from all of our drive-through test results. So because we have those contracts, they are submitting those data to us every day. But that is 1,400 tests daily. So you can imagine that is a lot of work for the team. And they've sent out also provider alerts and notifications to providers to make sure that not only are they reporting through the state system, but they're providing to us as well to make sure we have the most current data. So while we still are seeing an increases of somewhere between 70 to 90 cases a day, prior to this we've been seeing closer to 150, 200, 250 a day. So we don't know how much of it is a decrease in actuality versus the decrease from the underreporting. Our case investigators are still working tirelessly to investigate positive cases and to conduct contact tracing. In addition to the positive cases, we'll likely receive an electronic survey. So I've shared that with you before, that it's basically the contact tracing interview. And so we ask that if you receive that survey to please complete it and get it back to us as soon as possible so we can help notify folks that you have been around to let them know what to do in case they're have had a high-risk exposure with you, and then we can support them in their isolation and quarantine if that is required. The state has assured us that they're addressing this technology as fast as they can, but they don't have a time frame right now. So they're just saying that they are doing their very best, they're working very hard, and we will let you know as soon as we have information on what that time frame may be and when the data start to refill. So with that, I'm going to talk a little bit about our data updates. Every couple of weeks, I have a chance to update you on our monitoring criteria. So as it has been for the last number of weeks, we meet 4 of the 6 stability indicators. So we continue to be on that monitoring list. The state requests a positivity rate of under 8% over 7 days and a case rate of less than 100 per 100 residents. Even with the underreporting, we do not meet those numbers. We continue to have a 14-day case rate over 300, even with the underreporting, and we have a positivity rate that is over 10%, even with the underreporting. We do have approximately 59% of our ICU beds are currently being utilized, so we have some capacity there. And we continue to see more younger people hospitalized in our community. Hospitalizations remain the highest for those who are ages 40 to 59, and they are higher in that group than any other population. We're also seeing increases in hospitalizations in younger folks in the ages 20 to 39, has been reported before. We are at the highest level of hospitalizations among our community members. So currently 59% of our hospitalizations are coming from our community and not from our skilled nursing facilities and long-term care facilities. That is the highest that we have had so far. So there is more community spread and more people are becoming ill in the community and ending up in the hospital. I wanted to give you a quick update on our sheltering. So we do continue to work to provide shelter to our people experiencing homelessness in the city. We have our Project Room Key site, which is housing nearly about 130 people right now, and we have 70 beds at through our extension of our cold weather shelter in North Long Beach. We also run an isolation and quarantine site for people experiencing homelessness and those who are living in households where they're not able to safely quarantine and to isolate. And that site has 24 beds. So we continue to provide those opportunities. We have completed the construction of our year-round shelter that plans to open, and we'll be able to start housing people sometime in September. And we're looking forward to that opportunity. We'll be sharing much more about that as we get to that time frame. That housing will support 125 people. And our multi-service center has remained open throughout all of this, providing showers, services, safe parking, and connecting to services and permanent housing opportunities. At this time, we've had no COVID-19 outbreaks in any of our sheltering sites. So I want to just, continue to remind people, a lot of people are starting to get together, and they're starting to get together with their friends, and they think that small groups in their backyard and other spaces are safer, are fine as long as they're spending a lot of time with each other. I want to remind people that although you're missing your family, your friends, celebrations, and all sorts of events, that it's not permitted under the state or your local health order. So COVID really, I keep calling it the fun killer. It's a fun killer for many, many ways, but there's so many things that we want to be doing that we really ask you not to be doing through this time. So from we do follow up with individuals who test positive, and we find out that the place they're getting it is when they're spending time with their family and their friends in gatherings. So please pay attention. I know it's tempting, but we still have Zoom and other electronic means. We ask that you not be complacent. Our actions collectively continue to be important in trying to reduce the impact of this pandemic is having on our health, our livelihoods, our relationships, our families, and our future. Even if you yourself have not experienced the tragedy from COVID-19, know of many of your neighbors, coworkers, and community members who have, and I'm sure you have heard others. And so we ask that you take your stand and your strength in our ability to prevent further tragedy from occurring. While we've been restricted, there are activities that are allowed outside. They're safe. So most of those are just being outside, keep maintaining your 6 feet away, wear your face coverings. There are many, many things that you can be doing in terms of exercise, activity, waving to your neighbors and others while you're outside. So as I close, I want to really recognize the role of our nonprofit organizations in the city. I've had an opportunity over the the last few days, last few weeks actually, really have a chance to talk about all the different work that they are doing. They are truly at the forefront of our COVID response in our communities who have been the most impacted by COVID-19. They're supporting people by getting access to services, food, connecting them to their benefits, helping them with care, educating them about COVID, and so much more. You've been hearing a lot about the CARES Act and the support for businesses. There's also CARES Act funding for nonprofit organizations. So there are a number of different resources focusing on the Nonprofit Relief Fund, our food supports, our PPE, early child, older adults, domestic violence, and others. And so many of those different pieces of the CARES Act will be going out and will be available to nonprofits to apply. Our goal is to make it absolutely as easy as possible to allow for organizations to apply for multiple pieces of the CARES Act funding. So it might be that you apply for food distribution, PPE, and the ability to connect people to early childhood, for instance. So all of those are opportunities. We hope to be launching that within the next couple of weeks, and just want to be able to share that folks, that those resources are becoming available, and we realize the importance of our nonprofit organizations in our communities as well as our businesses. So with that, I'm open for questions.
All right, thank you. We have a few questions from the media. First question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, so I have two questions for Kelly. First of all, in terms of the state's underreporting, do you know how far back that issue goes and how long, I guess, the state's data may have been impacted? And number two, can you share what the specific positive testing rate is right now?
Well, so we don't know how far back it goes. We know it goes at least a week, probably 10 days. We were starting to notice, everybody was starting to notice decreases sort of in the, late July, like the last week of July, a little before that. And we were sort of looking at it as, things are starting to slow down a little bit. So we don't know if things were starting to slow down a little bit or whether those were from the data. But so people are thinking that it was at least through the last week of July into this week. In terms of the positivity rate, we aren't reporting that right now because it's not accurate, and we don't want people to focus specifically on it. It is above 10%, and as of our last read of it, which means that it is still, greater than the 8% that the state focuses on.
Thank you, Kelly. Next question comes from Philip at Q Voice News. Go ahead, Philip.
Hi, can you hear me?
Yes.
Hi, is the mayor taking questions?
Yes.
Hello?
Okay.
Go ahead, Philip.
Yeah, I was wondering, is the mayor taking questions?
Yes, the mayor is here to answer questions.
Yeah, I'm here.
Oh, okay. I couldn't see any visuals or anything. A couple quick questions. Number one, the city clerk certified a petition a couple of weeks ago for a recall effort, and folks are beginning to gather signatures to try to get the recall of your on the ballot. I'm wondering what your response is to that. And second question is, one of the issues you raised in response to the recall petition was the 100% score that the Human Rights Campaign has given the city of Long Beach. And one of those items that the city promotes is a gay and lesbian advisory task force to the police department. But that advisory task force hasn't existed for at least 3 or 4 years. So I'm wondering why the city's promoting a group that doesn't exist.
As far as the second part of the second question, I'm not sure. First of all, this is I think you're talking about a political document. So this is a city conference, so I can't speak to the political question that you're talking about. As far as the HRC score, I think the city scored 100 in the last 4 or 5 years. Kevin, the city scored about probably 100, and we can send you the exact the exact numbers. As far as people, this is America, and people can choose to express their opinions however they'd like, and that's okay. Next question.
All right, thank you. Next question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. So with the drop in hospitalizations, this is for Kelly. If with the drops in hospitalizations, are you hopeful that the case numbers are also trending down? I know that, with the underreporting, it's really hard to tell, but we do know that hospitalizations is an indicator of that. So I'm just wondering if you're hopeful that the case numbers are also trending down and the public's behavior is changing in regards to physical distancing.
Am I hoping that's the case? Absolutely. I think what we are seeing at our test sites is that there's the demand at the test sites has begun to stabilize. And so, for a long time, there were just so many people that felt they needed to be tested, and that has stabilized. So we're seeing that as fewer people maybe are symptomatic or feeling that they are around people who are exposed, who are that because of wearing masking and distancing and those sorts of things. So we're hoping that that is an indicator, and also the hospitalizations. So really, for us, hospitalizations are sort of a lagging indicator when we look at COVID. So, for someone to be in the hospital, it usually takes time for one from an exposure to the point that someone may experience symptoms, be tested, find out they are positive, and then the time for which they may end up hospitalized. So we tend to think that that's a couple weeks. It's referencing what is happening from a couple weeks ago in terms of our case rate. So it's not really a reflection of today's cases, but more a reflection of cases from a couple of weeks ago.
All right, thank you. We have one last question from Philip at Q Voice News. Go ahead, Philip. Okay, I don't think we're picking up Philip. So we'll go ahead and close questions now, and we will go on to Spanish translation.
Muy buenas tardes. Hoy es nuestro comunicado de prensa para hoy jueves 6 de agosto del 2020. Vamos a empezar con el alcalde. Habló un poco sobre nuestro comunicado de prensa de este lunes pasado, donde hablamos de nuestro presupuesto anual para el año fiscal 2021. La ciudad incluye el puerto, departamento de salud y agua y también servicio al público. El presupuesto para el año 2021 es de $2.600 millones y tenemos un déficit de 30 millones. Durante esta pandemia, la ciudad ha gastado más de 100 millones de dólares en respuesta a COVID-19 y ha perdido dinero por impuestos de ventas, hoteles y aceite petrolero. La ciudad espera ser reembolsado dinero por el gobierno federal, pero todavía no se sabe cuánto o si será la cantidad entera. Vamos a empezar con información general. A partir de hoy, 8.709 residentes han dado positivo por COVID-19. Además, aproximadamente 7.392 personas se han recuperado. Y lamentablemente hemos perdido un total de 180 residentes de Long Beach por COVID-19. De estas muertes, 124 se han asociado con centros de atención a largo plazo. Vamos a hablar ahora sobre algunos de los puntos de datos. Por favor, quiero que tomen en cuenta que es posible que haya escuchado sobre un problema técnico con el sistema de informes del Laboratorio del Estado que está afectando nuestra capacidad de compartir algunos datos con ustedes. El Estado ha descubierto un subregistro de casos reportados de COVID-19 debido a problemas técnicos. Acaban de preguntar desde hace cuánto y no se sabe, podría ser de 7 a 10 días. Voy a hablar sobre la primera imagen que se mostró que enseña los casos por día. Esa imagen indicó los casos de COVID-19 por fecha de episodio. Durante nuestra última presentación de datos hace 2 semanas, nuestro recuento de casos fue de 7.000 225. Hoy nuestro recuento de casos para la ciudad es de 8,709, un aumento de 1,484. Siempre advertimos que debemos tener cuidado al sacar conclusiones sobre lo que parece ser una caída en los casos en las últimas 2 semanas con ese gráfico debido a un retraso de información. Los datos en ese gráfico reflejan las últimas 2 semanas, aumentarán mientras los resultados pendientes de las pruebas son recibidos por el Estado. Definitivamente veremos un aumento en esos números y aunque en esta imagen parezca que los casos están disminuyendo, no es el caso. Hasta la fecha hemos realizado más de 146,000 pruebas en la ciudad de Long Beach. La imagen número 2 enseñaba casos por población. Long Beach estaba representada por la línea azul clara y el número de casos por cada 100,000 habitantes también se ve afectado por el problema de los datos y es probable que se haya subestimado. Continuamos estando más bajos en casos por 100,000 en comparación con la ciudad de Los Ángeles y el condado de Los Ángeles. Ambos también se ven afectados por el problema del informe de datos. La imagen número 3 mostrada era muertes por 100,000. Long Beach está representada también por la línea azul clara. Nuestras muertes de COVID-19 por 100,000 están por debajo de la tasa del condado de Los Ángeles, pero por encima del nivel estatal. Este informe no se ha visto afectado por el sistema de informes del estado. Lamentablemente, seguimos teniendo aproximadamente de 1 a 3 muertes diariamente. Lamentamos la pérdida de los 180 fallecidos y extendemos nuestro más sentido pésame y oraciones a las familias. Imagen número 4, hospitalizaciones a lo largo del tiempo. Las hospitalizaciones se informan diariamente, pero con el tiempo los números cambian a medida que recopilamos información más precisa. Como había mencionado yo hace unas semanas, hay personas que son residentes de Long Beach, pero están recibiendo asistencia médica fuera de la ciudad, quizás en otro condado u otro estado. Cuando esa información llega, que esa persona sí es positiva, tenemos que cambiar los números que reportamos para ese día. El número de personas hospitalizadas ha disminuido ligeramente en las últimas semanas, lo cual es una buena noticia. Actualmente tenemos a 92 residentes hospitalizados por COVID-19. Y nos vamos a imagen número 5, los datos de los hospitales aquí en la ciudad de Long Beach. Nuestra capacidad hospitalaria continúa siendo estable y adecuada. Nuestro uso de camilla está a 57% y tenemos 325 camillas adicionales disponibles y 100 camillas en el centro de convenciones de Long Beach que también están disponibles. Seguimos teniendo una cantidad suficiente de ventiladores para satisfacer la demanda existente y futura y mencionaron que el uso de ventiladores ahorita está al porcentaje de 41%. Además, tenemos cerca de 1,5 millones de unidades de equipo de protección personal en el inventario, guantes, mascarillas, todo lo que se ocupa para servicio médico. Vamos a hablar ahorita sobre los programas para pequeños negocios. La ciudad prometió ayudar a aquellos negocios que fueron afectados por los hechos del 31 de mayo. El ayuntamiento ha establecido el Fondo de Ayuda para la Reconstrucción de Long Beach. El programa va a ofrecer dinero para aquellos negocios que fueron afectados y tienen aproximadamente $1.25 millones que estarán disponibles y estarán ofreciendo hasta $10,000 a las empresas elegibles. Los dueños de negocios pueden llamar a la línea directa de negocios de Long Beach al área 562-5704-BE o 562-570-4249 de lunes a viernes de 8 de la mañana a 5 de la tarde. Asistencia también estará disponible en persona aquí en City Hall, 411 West Ocean Boulevard, de 8 de la mañana a mediodía los días martes y de mediodía a 4 de la tarde los jueves, hasta el 29 de septiembre. También queremos decirles que una cita no es necesaria, pero si necesitan asistencia en español, pueden llamar con anticipación mandando un correo electrónico a 4biz@longbeach.gov. El programa de calles abiertas es un esfuerzo para apoyar a la recuperación de COVID-19 para los residentes y las empresas. El Consejo Municipal de Long Beach aprobó una iniciativa de calles abiertas para transformar temporalmente las áreas públicas en espacios seguros para la actividad físicamente distanciada. Este es un programa que comenzamos a mediados de junio, incluso antes de que los restaurantes cerraran, y ha despegado desde entonces. Hasta la fecha, el Departamento de Obras Públicas ha instalado más de 100 parques temporales en toda la ciudad, brindando a las empresas espacio al aire libre para realizar servicios de distancia físico. Esto incluye comer, cortes de pelo, manicures y otros servicios. Para obtener un mapa interactivo que muestra todas las ubicaciones actuales de Open Streets o calles abiertas, o para solicitar un negocio o vecindario Open Street en su ubicación, visite longbeach.gov/Open Streets, OPENSTREETS. Ahora vamos a la sección de salud, donde la directora del Departamento de Salud, Kelly Colopi, dio su información. Empezó con el sistema de datos del Estado, que ya mencioné. También lo mencionó el alcalde, que el Estado de California descubrió un subregistro de casos reportados de COVID-19 debido a problemas de tecnología con el sistema de informes electrónicos de laboratorio, que informa al sistema de registro de enfermedades del Estado, que se llama CalReady. CalReady recopila datos sobre muchas enfermedades transmisibles, incluyendo enfermedades de transmisión sexual. El problema del Estado está afectando nuestra capacidad de responder a enfermedades, no nomás de COVID-19, sino otras enfermedades que también se mantienen registradas. Por favor, queremos informar que tenga en cuenta que la atención al paciente y los resultados de las pruebas no están afectadas o retrasos por este problema. Nuestros laboratorios locales aquí en la ciudad de Long Beach continúan informando los resultados de las pruebas directamente a los proveedores y hospitales. Además, nuestra información de hospitalización y muerte no se ve afectada, ya que se informan directamente al Estado a través de diferentes sistemas. Localmente, nuestro equipo está trabajando para ingresar manualmente los resultados de laboratorio de nuestros sitios de prueba. Este es un gran esfuerzo, ya que estamos cumpliendo más de 1,400 pruebas diariamente. El Departamento de Salud también ha enviado alertas y notificaciones a los proveedores para recordarles que informen todas las enfermedades transmisibles al Departamento de Salud de manera oportuna. Todavía recibimos entre 70 y 90 casos nuevos de COVID-19 al día. Ahora, recordemos que hace unas semanas habíamos visto hasta 120 por día. Ahorita no sabemos si es porque ya está bajando o porque se están retrasando los datos del Estado. Nuestros investigadores de casos siguen trabajando incansablemente para investigar casos positivos y realizar un seguimiento de contactos. Otra vez recordamos, si usted recibe una encuesta electrónica, ya sea por correo electrónico o mensaje de texto, por favor asegúrese que lo complete y lo entregue lo más rápido posible. para poder detener la propagación de COVID-19 aquí en la ciudad de Long Beach. El Estado nos ha asegurado que están resolviendo a estos problemas tecnológicos, pero no se sabe cuánto tiempo se vaya a tardar para poder agarrar esos casos confirmados y estar con los datos al día. Comencemos con nuestro resumen de datos revisados, revisando los indicadores de estabilidad, que es lo que el Estado está siguiendo para la lista de monitoreo de lo que estamos hablando. Vamos a hablar, la imagen número 6 que se mostró enseña los criterios de estabilidad para Long Beach. Aunque nuestra tasa de casos por 100,000, probablemente sea subestimación, dado a la situación con el programa del Estado. Estamos trabajando con datos incompletos y sabemos que estamos a mediados de los 300, que es mucho más alto que el total de 25 por 100,000 que necesitamos alcanzar. En otras palabras, ahorita no tenemos un número exacto, dado que tenemos ese problema con los datos estatales. Se estima que estamos a medida de 300 personas positivas por 100,000. Tenemos que bajar a 25 personas por 100,000 para poder seguir al segundo paso. En este momento no tenemos una imagen precisa de estos indicadores debido al subregistro de casos positivos. Ahorita aproximadamente el 59% de nuestras camas de unidad de cuidado intensivo están utilizadas. Estamos viendo a más personas hospitalizadas a edades más jóvenes en nuestra comunidad. Las hospitalizaciones son las más altas entre el grupo de personas entre los 40 y 59 años de edad. También estamos viendo un aumento en las hospitalizaciones para aquellas personas entre 20 y 39 años de edad. El 56% de nuestras hospitalizaciones relacionadas con COVID-19 vienen de nuestra comunidad. No están viniendo como anteriormente de esos locales que de largo servicio, por decir, lugares que tienen a personas de tercera edad. Esta es nuestra porción más alta hasta la fecha. La imagen número 7 tiene el estado del indicador de Long Beach y vamos a hablar sobre los criterios de preparación establecidos por el Estado para guiar a nuevas aperturas. Esto incluye capacidad de refugio, hospitalizaciones estables, tasa de positividad de prueba, capacidad de prueba, oleada hospitalaria y instalaciones de enfermería especializada. En este momento estamos cumpliendo 4 de los 6 criterios. Nuevamente, no tenemos una imagen precisa de nuestra tasa de positividad actual, pero sí sabemos que no estamos cumpliendo con el mandato de máximo del 8% que puso el Estado. También queremos mencionar que la ciudad sí tiene lugares para personas que tienen que mantenerse aislados y no tienen hogar. Tenemos 24 camas disponibles. También mencionó la directora que para septiembre van a tener ya abierto el local que estará abierto los 12 meses del año para personas sin hogar. Un recordatorio para todos que están viendo esto es que todavía no deben reunirse. Queremos recordarle a todos que aunque extrañamos a nuestros amigos y familiares, todavía no se permite reuniones de ningún tamaño con personas que no viven en su hogar. En el seguimiento que hacemos con personas que dan positivo, seguimos encontrando que las reuniones señalan como lugares donde es probable que las personas se hayan infectado. Entonces, con el contacto los contactos que estamos llamando, hablamos con una persona, nos dice con quién ha estado en contacto y se ha determinado que muchas de esas personas han salido positivos del COVID-19 después de una reunión. Se le recuerda que la enmienda a la orden Más Seguro en Casa prohíbe las reuniones de cualquier tamaño y esto fue emitido el 28 de marzo, hace más de 4 meses. Hemos estado en esto durante mucho tiempo y es probable que tengamos un largo camino por delante. Y si las personas no siguen esas órdenes de Más Seguro en Casa, esto va a alargarse todavía más. No podemos ser complacientes, nuestras acciones colectivamente continúan siendo importantes para tratar de disminuir el impacto que esta pandemia está teniendo en nuestra salud, nuestras vidas, relaciones y nuestro futuro. Incluso si usted no ha experimentado la tragedia de COVID-19, sepa que muchos de sus vecinos, compañeros de trabajo, miembros de la comunidad pueden tenerla y usted puede ayudar a prevenir que ocurra otra tragedia más de los 180 personas que hemos perdido aquí en la ciudad de Long Beach. Aunque hemos sido restringidos, hay actividades permitidas en la orden que se consideran de menor riesgo, muchos de ellos al aire libre y con distanciamiento de más de 6 pies. Por favor, sea responsable y piense en los demás, siga siendo su parte. La directora de salud también quiso dar las gracias a todas las organizaciones sin fines de lucros que están al frente de la pandemia apoyando a la comunidad con servicios de comida, paraviles y otra asistencia. También sabemos que la acta federal CARES Act traerá asistencia muy necesaria para aquellas organizaciones y queremos informarles que la ciudad está trabajando rápidamente para poder ofrecer esas aplicaciones y hacer el proceso de asistencia clara. Como recordatorio, las sesiones de información son cada lunes y jueves a las 3 de la tarde en vivo. Eso es todo por hoy. Gracias por acompañarnos. As a reminder, briefings are on Mondays and Thursdays at 3 p.m. We thank you all for joining us. That is all for today.